Good evening and welcome to Health Check. My name is Grace Mutiso, and tonight our focus is on arthritis, which is a condition that affects very many people across the globe. And tonight we'll be having a discussion around how do you manage, how do you treat, how do you live with arthritis condition, which affects your joints, ankles, back, fingers, wrist, and many other areas of your body. Joining us tonight to have this discussion is Dr. Felix Koguru, an orthopedic surgeon, and will be bringing us into speed around this topic. Remember to join us. We are live at Hope TV. We're also live on YouTube and Facebook at Hope TV Kenya. And you can engage with us with any question or comment that you have. Our WhatsApp line is 0708 222 323. That is 0708 222 323. You can also engage with us. Our SMS line is 20933. Of course, that's your question with the word health check. Welcome to Health Check tonight. My name is Grace Mutiso. Allow me to invite Dr. Felix to join us this evening. Good evening, Daktari.
Good evening. How are you?
I'm fine, and you?
Very fine, very fine. Happy to be here.
Karibu sana. You look like you've just been from the hospital.
I can smell, I think maybe I smell like that, but...
No, you appear like that.
But yes, we've just come from theatre.
Yes.
So I just made a rush to come over and just be with you guys during this time.
Okay.
Yeah.
Tell us a little bit about yourself and what you do.
So I'm Felix Kogoro. I'm an orthopedic surgeon, trained within the College of Surgeons of East, Central and Southern Africa. I practice mainly pediatric orthopedics, but also during my spare time, I also dabble a bit in adult orthopedics. Yes, so I'm a born-again believer, and I think I enjoy my work. I think it pulls me close to people. I feel like I make a difference once in a while. So I think it's a very fulfilling work. I don't think I would be doing anything else, I think, yeah.
Oh, yeah. Amazing, amazing. Yeah. So we're discussing about arthritis today. Let's begin by defining what is that? What is this condition? All right, so
arthritis basically can be looked at in two words. So arthro, which is the first part of that word, itis. So arthro means joints, and then itis usually denotes inflammation. So it's an inflammatory condition within the joint. And inflammation usually is characterized by certain features, including pain, warmth, redness. So all of those are features, and reduced function. All those are features consistent with an inflamed joint, or even when you have inflammation around your skin or around any other body part. So those same 5 or so features that are consistent with arthritis, we also find them in inflammation around the body. Yes.
Okay.
Basically.
So inflammation around the joints.
Around the joints.
So it's a condition affecting the joints.
Correct.
Is it okay
correct.
to say
correct.
That?
Yes. So it affects all the joints, from the spine, as you from the digits, the wrist to the elbow, to the shoulder, spine again, to the hip, and also to the knees, and also to the ankles, and even the digits of the feet.
Okay.
Yeah. So it's as long as there is a joint, as long as there is movement. There is the articulation between cartilage, space, and then cartilage. All those surfaces are prone to getting arthritis.
Okay, and what causes it?
So before I think we look at the causes, I think it's we can look at the types, because that will inform what causes the arthritis. Okay. For example, if you have septic arthritis. So septic arthritis is an inflammatory condition of a joint that arises from an infective process. So if you have a bacteria that has affected a joint, then you'll have and there is spas within the joint, and there is inflammation within the joint. In that case, we shall call it septic arthritis. There is old age or wear and tear arthritis, which we refer to as osteoarthritis. So that is basically elderly patients who have been using their joints for long. This will then lead to wear and tear of these joints. And this goes ahead to cause what is called osteoarthritis. There is an inflammatory condition called rheumatoid arthritis. That's a different type of arthritis where your body creates certain antibodies against structures within the joint and affects and actually destroys the joint. So it's your body fighting itself. And this goes ahead and destroys the joints. So that is an inflammatory condition in patients who have a predisposition for the immune system to overreact, sort of like patients with allergies and even some genetic traits within their genetic makeup that makes them susceptible to creating antibodies against structures within their joints. So it just depends, I think, on the type of arthritis, and these will have different causative agents. If you look at, for example, post-traumatic arthritis, so that someone has gotten an injury around and about a joint. For example, you break your distal thigh bone, the end of this thigh bone that sits within the joint. If you injure it, maybe from the injury itself or from improper correction or return to normal fit, which we call reduction. An improper reduction during surgery of these joints, or even failure of even surgery, could lead to a bit of a step off. And this step off, because the joint wants a very smooth surface. Yeah. So if it's not very smooth and there is a step off in that joint, then it will lead to abnormal wear. So every time it moves, it's dinging on that step off, and that will then lead to arthritis. Yeah, so I think it just depends on what type of arthritis it is, and then even hence we can be able to deduce the causative agents.
And is there, I know as you've been explaining the different types of arthritis, you've been able to share also the causes of those different types of arthritis. Yeah. And what is the most common type of arthritis in Kenya?
So the most common that we come across is, I think, would have to be a mix between osteoarthritis and also rheumatoid arthritis. Osteoarthritis is especially in patients who are elderly, 50s, 60s, 70s, 80s. I'm not saying that 50 is old, but usually depending on how much you're using your joints. But also rheumatoid arthritis, we're seeing it even in young patients, some juvenile ages, 15, 16. We're seeing it in very young kids who have this genetic predisposition to want to, for their body to want to fight the structures within their joint. Yeah, so just lightly put, just basically put. So I would have to say it will be between osteoarthritis, just because of our population is getting older and older. Yeah. Especially in the rural areas of Kenya, we're seeing a lot of arthritis. So age, osteoarthritis, and also rheumatoid arthritis.
Okay. Dr. Felix, I've heard you keep saying the use of joints, and I get worried because I also use joints. Do you mean that? Is there a way that either we use our joints wrongly and we are prone to getting arthritis, or it's something we are consuming, or it's something you're not doing? Could you help us explain that?
Yeah, so wear and tear. For example, if I put on a shoe I keep giving this example even to my patients. If I keep using a shoe for the next 10 years, when I look at the sole after the 10th year, I would see there'll be a bit of a change.
Yes.
So some of this wear and tear arthritis is inevitable. We are not able to stop it. However, weight loss is a very important factor in the development of osteoarthritis. So the more the weight that the joints, the more the load that the joint is taking, then the more it has to carry. Every time you fall and you're a bit on the heavier side, there is much more energy going through that joint. There is much more risk of that joint getting injured. So I think with as we continue to see these patients who are obese, we're seeing more and more even 30-year-olds, 40-year-olds who are coming to clinic with very severe back pain because there's wear and tear also of the spine, of the joints within the spine. And with that wear and tear, just because of the amount of weight that that spine has to carry, then it leads to early leads to arthritis. So some of it is inevitable. For example, in runners,
Yes.
if the surface that you're running on is not very pliable, that one, the shoe that you're using does not take some of that impact every time you strike the ground. Two, the surface that you're running on should also be pliable enough. Like running on tarmac, you see that's a very firm surface.
Yes.
So those patients, you'll tend to see arthritis coming in as well. But it's a tricky balance. You either see the orthopedic surgeon for arthritis, or you see the physician for diabetes, and because for the runners, that is.
Yes.
So I think it's just a balance. How to, for example, how to lift even items from the ground.
Yes.
Improper, what we call ergonomic practices, can lead you to can lead you to have early osteoarthritis in your in your spine, for example.
Yeah.
Yeah. So I think it's just, I'm not saying that don't use your joints, but just the fact that we're using it sometimes improperly. For the ones who are using the joints improperly, then at least the arthritis will come in earlier.
Okay.
For those who are using it as it should, it's just an eventuality. It's just an eventuality that at some point your joints will wear out.
Okay.
Yeah, that a 70-year-old's knee does not look like a 18-year-old's knee. There has to be a bit of difference because there has been time that this joint has been used.
Okay. I know you've mentioned, common things, how we lift things, the shoe we wear, and somebody will think, really, that causes arthritis? Could you explain to us about that?
So
the
the
lifting and the type of shoe.
All right, so with the lifting, for example, the structures that stabilize the spine.
Yeah.
So the ligaments that run on the top of the spine, the ligaments that run around the spine, and there are some joints that allow movement of one spinal body against the other.
Yeah.
So that joint, on those joints, in patients who we are seeing carrying heavy items, they're in their farms all day lifting things, or they're working in a construction site, or people usually come and say, oh, nikiwa mdogo nilikuwa nafanya kazi ngumu sana. So that improper lifting of things. For example, when you're lifting this, I bend over and lift it from my back.
Yeah.
That tends to strain the back, and sometimes even that can lead to some tears within the stabilizing structures of the back.
Yeah.
So that then goes ahead to cause some instability.
Yes.
With that instability, there is abnormal movement of, so when one is moving like that, the other one moves in a different direction. So that abnormal movement of the spine then creates abnormal wear of the spine.
Yeah.
And with abnormal wear, then it leads to arthritis in that process.
Yeah.
With the shoes, what I meant with runners is that if you don't use the proper shoes, for example, a shoe that is pliable and takes, every time you're running, for example, I'm 100 kilograms weight, every time my foot strikes the ground, that is quite a bit of force coming from your ankle to your knee, to your hip, to your back.
Yes.
So all that, if that force is not dampened, if the sole of the foot does not take some of that compression, then all of that is transmitted directly up into your, through all those joints. And repeated, for example, people are doing 10 kilometers a day, people are doing 15 kilometers a day. I'm not saying that is wrong.
Yeah.
I'm just saying that it can lead you to wear out your joints much quicker. Yeah, just because of use. Yeah, because me, the last time I ran 10 kilometers was never. So maybe I'll use it. Of course, I'm not going through that strain through my joints every day.
Yeah.
But then I'll have to go and talk to the doctor. Oh, my sugars seem to be a bit high because now I am fighting with being fat.
Yes.
And all that. Yeah. So I think it's just that those are the things that I was alluding to. But running, I think, is a good choice.
Yes.
Cardiovascular exercise, I think, is a very good choice. Swimming, I think, is one of those exercises that reduces the amount of strain to your joints because there's no strain in your joints whatsoever.
Yes.
There is no pressure going through your joints as you do that. Cycling is another low pressure, because as you're cycling, there isn't much stress going through your joints.
Yes.
Yeah, so it's even it's a less impact. There's less impact with cycling as well.
Okay. You know, you talked about shoes, and I know ladies, we love our shoes. We love them really high and so many inches. Asking on behalf of a friend, can that
not you,
cause
of course.
one to have in the long run? And even these days, we see parents having young girls, and you know, causing them
With
to
a
wear
bit of a heel.
heels. Yeah.
Yeah. It just changes a bit of the dynamic of how we are bearing weight. The foot itself is supposed to be a tripod. So this is the heel here, and then that's the base of the big toe, and that's the little toe.
Yes.
So that tripod must sit on the surface. When you change the tripod, I'm not saying that, I've not seen studies that say that actually wearing high heels for a long time causes osteoarthritis, but a change in that tripod causes a shift in how the biomechanics, how that weight transmits, because that weight should come from the center of the hip to the center of the knee to the center of the ankle.
Yes.
If that, with the foot in a heel, it can change that dynamic a bit.
Okay.
But I've not seen any studies that actually say that 1 + 1 is 2, i.e. wearing heels equals arthritis. No, I've not seen such studies. But if you fall, then I would just think, like thinking out of the box, if you fall as you're wearing your heels, you could strain your ankle as you're falling, and that leads to some injuries to the knee, to the ankle, and then later arthritis as well.
Okay. Yeah. We're talking about arthritis, and I'm hosting Dr. Felix Koguru, an orthopedic surgeon. Do you have any questions regarding our topic of today? Engage with us. We are live at Hope TV Kenya on Facebook and YouTube. We'll be sampling some of your questions and comments right there. You can also SMS us on 20933. That's our SMS line. You can also talk to us on WhatsApp. Our number is 0708 222 323. That is 0708 222 323. The numbers are right at the bottom of your screen for any question that you have regarding our topic of arthritis. Please keep the questions coming so that in a short while we'll be getting to them. So, Dr. Felix, who is at risk of getting arthritis?
I would say we all are, as an eventuality of age, in terms of getting osteoarthritis. In young patients who are playing sports, in young patients who are prone to motor vehicle accidents, motorcycle accidents, those patients, if they should get that accident and it is a periarticular injury, i.e. around the joint, then that actually leads to an increased risk. In children, for example, for the septic arthritis, so in children who have one form, or even adults who have one reason or the other for reduced immunity. For example, if you have malnutrition in our setup, an infection picked up from somewhere else in the body could travel through the blood and seed into a joint, and that leads to a septic arthritis. In patients who have a very low viral load with HIV and they get an infection elsewhere, they could also lead to getting septic arthritis. In IV drug users as well, who are injecting close to joints, and even through that tract that sometimes they don't clean the area that they are going to give the drug. So once they inject, that bacteria gets into the blood and goes and seeds into the joint. For rheumatoid arthritis, family history is very high up there. And atopy, the ability to over-respond to otherwise normal stimuli. For example, if some people come into contact with a bit of dust, they sneeze a lot.
Yes.
If some people, you're wearing a strong perfume, they tend to overreact to that. Otherwise, in someone else who does not have that same allergy, will will not have as bad a reaction. Yeah, so patients with atopy will also lead to, can also cause you to get rheumatoid arthritis. Yeah, basically, yeah.
Okay. And are there some of the risk factors associated with arthritis?
Yes, as I said, strong family history. My mother had arthritis. I'm also at 50. My joints are also having problems. Family history is very important, as there is a genetic predisposition that can be transmitted down the line. Risk factors, as we were saying, for young patients, trauma, sporting injuries as well. They tear some ligaments within their joints. For example, if you tear one of the ligaments, or there's a cushion within that joint, so if there's an injury to those, and those are not very well managed, later on it could lead to early wear and tear of that joint. In patients who, for example, in weightlifters, who are not lifting correctly, and they are actually lifting, or even people who are doing a lot of manual labor and they're not lifting correctly, of course that will then lead to early wear and tear of the spine. And then, yeah, basically, but as I am saying, the older our generation gets, the better our healthcare gets, the more our population will get older and older, because now they're no longer dying from diseases that can be prevented with the healthcare system. So as our generation, as our population gets older and older, then we are now seeing a lot more patients coming in with hip, knee, and spine arthritis as well.
Okay. And as before we go to a quick break, so as a patient walks in to see you, what are some of the symptoms, that they present themselves, that you're able to say this is arthritis, whichever type?
Okay.
Yeah.
So I think something that runs through all the types of arthritis is usually pain. So patients will present with pain. Sometimes they say when it's very cold, they feel that the pain is getting worse, especially during cold seasons like now. The other thing is sometimes they may feel if it is a subcutaneous, like a joint that is close to the skin, like for example the knee, sometimes they can feel a bit of warmth, they can feel a bit of swelling. They can feel a bit of, especially within the knee, they can feel some clicks within the knee, and even when you're examining them and they're moving their knee, then you can, when you put your hand on the knee, you can actually feel some clicks within the knee, which would mean that there is arthritis between the kneecap and and the distal and the end of this thigh bone. And even reduced function. I'm now no longer able to do this, I'm no longer able to do this, or when I do this activity, then I have a lot of pain. With spine, then there are other things that may arise. Numbness, for example, arthritis in the spine will give you numbness, will give you pain, and this pain can be radiating down radiating down to the lower limbs. Some of them can present with bowel and bladder issues, inability to control, depending on how bad the spine arthritis is. Yeah. So basically, it just depends on the joint that is involved. If it is ankle arthritis, they usually say, when I'm driving, especially if I'm driving a manual car that needs a lot of your ankle to be moving along the pedals, then usually they get a lot of pain. In patients who are they have difficulties in weight bearing, swelling is a big issue, especially with ankle arthritis. They usually complain a lot about ankle swelling as well. Yeah. So it just depends, one, on the joint that is affected or the system that is affected. In the digits, for example, for rheumatoid arthritis, they say, in the morning when I wake up, my fingers are very stiff, I cannot move them. There are nodules, there are swellings around my joints. But when the morning usually passes, the pain goes away and I can be able to move it. They usually report there is some deformity, that there is an abnormal angulation of their digits. just because of the reaction of the rheumatoid arthritis towards the joints. They could have some swelling, some nodules, what they call them rheumatoid nodules within the joint. Are some of the symptoms that these patients may present with. If it is an infective arthritis, then usually, mostly in kids, usually the child will come, the mom will tell you, oh, the child has not been playing as they have been before. The child has fevers, the child has been unable to use the joint, and the child looks very dull. So these are just features that would point towards an arthritis. Usually the usual story is that last week alikuwa na ka infection hapa, alikuwa na ka boil or something, then saizi amekuja kutoka shule, then child is not able to walk, then child is not playing, the child is dull, then usually your mind starts thinking septic arthritis.
Okay. And now, those are children that you're able to, maybe they're able to communicate. Does it also affect like infants, the newborns, up to around an age where a child is able to talk? So how can a parents diagnose and say,
Yeah. So usually, as I said, with arthritis, there is something we call functional laesa. Functional laesa, there is reduced function. So usually they'll tell you the child does not want to play with this arm. When you touch that arm, it feels warm. For example, the elbow will be warm. If it is the hip, when I'm changing the diaper, the child really cries when I'm trying to move it. They're feverish. They don't want to breastfeed. Irritability is a big thing that kids present with. If you see that your child cannot be soothed, usually they're soothed with breast milk. You breastfeed them, nothing happens. You give them their favorite toy, nothing happens. They're still crying. That is a very non-specific sign of there is something very serious going on. So irritability, if your child is, I'm not saying, okay,
all irritability.
All irritability, because
all of us come to you.
All mothers will present to hospital at night because the child will not sleep. The child will not sleep. But you've tried everything and anything and everything, and the child cannot be able to settle, then that warrants you to go to hospital. Yeah, because that irritability is also a sign of something a bit more sinister going on.
Okay. Yeah. I know when you come back, we'll be talking about the test, how you're able to do the test and then diagnose. So is it hereditary?
Yes, there is a genetic component towards it, towards rheumatoid arthritis and also osteoarthritis. There is a genetic component, usually runs in families. The inheritance pattern, it's not that it's a must that if my mother had arthritis, I will get arthritis. But it just puts you at a higher risk. But there is an issue of nurture and nature. Yes. So nurture is the genetic component. And then, nature is the genetic component. And then nurture is what you go through. For example, if we are born of the same parent, I go through a life that I'm carrying heavy things. I had an accident somewhere, I got injured. Then my brother has similar genetics, or could have inherited that gene from mom or dad, and this guy does not go through the same thing. So I will get arthritis sooner than my brother will. So there is what you come with, but it is also what you go through in your day-to-day that will then lead you to getting arthritis early or not.
Yeah. And is there, especially this now that we've known it's hereditary, is there something that a child can do, a grown-up child can do to avoid getting it? Like you're an adult, you have your family, and you've been you're staying with your parents, and dad and mom have arthritis. So I know.
So living a healthy lifestyle, an active lifestyle, is a good choice. Picking your cardiovascular exercise wisely.
Talk about that.
Yeah.
Talk about that.
Picking your cardiovascular exercise. That is number one. Even when patients come in with spine arthritis, we are mandated to be able to tell you that you need to lose weight. You need to lose weight, because failure to lose the weight, of course, as we were discussing, puts unnecessary strain onto your back. So with the exercise that you'll be doing, a cardiovascular exercise that you'll be doing, either if you enjoy running, I'm not saying that it is a bad thing, but just make steps, as we were discussing, to make sure that you do not put unnecessary strain to your joints. For example, if I'm 120 kilograms and I want to start losing weight, my first exercise should be I start by walking fast. So I walk, I get to a weight that, until I get to a point where I'm maybe less kilos than that I'm, because you understand that if I'm running at 120 kilos and if someone else is running at 70 kilos, the amount of strain to your joints every time you strike the ground is very different.
Yes.
So if you're very heavy, then a choice like swimming, as we were saying, or even cycling can be a very good option. Whether it is a stationary bike or it is a bike that maybe a road bike or something like that, that would be a good option to reduce the amount of strain going to your joints. As we said, swimming is another very nice choice for exercise. So choose your exercises wisely. Learn how to, for example, ladies are hunched over, they're bent and washing their clothes every day, for example.
Yes.
That puts a lot of strain into your back. So learning how to get a sit down, put a bucket, and then just wash with your back straight. If you want to hang your clothes, you put a basin onto a raised surface, and actually pick from the raised surface and hang from there, because you're trying to avoid the bending and standing, especially a loaded standing. When you're I mean loaded, that you're carrying something, then you stand. When the back is very rounded, we usually look at it as for example, your back is the back is in that shape.
Yeah.
That shape is not a strong position for the spine. The strong position is that there should be an arc to your back. That usually gives you a more stable spine. Yeah. So I think with those minor adjustments, make sure that we are not heavy, you're exercising, your diet is good. Also in terms of weight management, diet also is very key. Then it will lead to less arthritis.
Okay. You know, you've talked about ladies, and we love our little babies. We just, you lift them up. You put
Yeah.
Is that?
And it is not uncommon.
Oh my.
And it is not uncommon to find ladies who've just delivered, or maybe 2 years, 3 years. Ever since I delivered, Daktari, my back has been a mess.
What usually happens?
Yeah. So usually with the back, it's a mix of several things. One, there is you're now carrying an extra 7-8 kilograms around your midsection. And a short while before, you were not carrying that much weight. So that drastic change in your in the amount of weight that you're carrying as a pregnant female causes a bit of strain to your back. Two, there are some hormones that are released during pregnancy that tend to cause ligaments to relax and all that. So usually with that, they tend to cause some of the stabilizing structures of the spine to get a bit relaxed and a bit loose. So instability arises, and then the process goes from there. Lifting, for example, as you're saying, the child is now 7 kilograms. You still want to play with him or her as you are playing before. So it is an excellent thing to play with your kids, but it is, of course, with a bit of safety also to yourself. You have to be conscious as you're lifting the child, and as the child continues to grow, then that you're lifting the child in a particular way that is safe for your back.
What is that safe for our back. You know, we forget a lot that Harry will just come. They'll come running. I'll just be. What's the safest way to live?
As we said,
my 7 kg old boy.
You do not want to round your back.
Okay.
So you want to have your back straight. Sorry. You want to have your back straight and lift and bend your knees and then lift from your knees. Throughout that whole process, my back has been straight. I have lifted the child with my knees.
Oh.
So lift from your knees and not from your back would be the way to go.
Okay.
Yeah.
Does that apply to any other thing I need to lift up?
Correct.
Knees,
Correct. Lift from the knees and not from your back.
Okay.
If you're getting something from the ground, make sure that your back is straight at all times.
Okay. You're on Health Check right here at Top TV. Look and Live. My name is Grace Mutisa. I'm hosting Dr. Felix Kuguru, an orthopedic surgeon, helping us with this topic on arthritis. Do you have any question or comment? Talk to us. Our SMS line is 20933. That is 20933. 0708 222 323 is our WhatsApp line. I believe this is a good point for us to take a break. And when we come back, we'll be sampling some of your questions that will have come through to us on those platforms and also on Facebook and YouTube. Our handle is at Top TV Kenya. Keep it right here.
Only God can turn a mess into a message.
I have a boy on a wheelchair.
Yeah.
I'm still preaching on the pulpit.
Amen.
Niliona mguu ya nyuma inakuja tu kunikanyaga, imenilenga tu kwa tumbo, nikaitana tu Jesus.
I got tired of working with the x-ray papers, and one day I just woke up and decided to burn them.
A test into a testimony.
The whole community didn't want to hear that anybody is born again. Excommunicated straight.
Bila Yesu hakuna njia.
Join Sharon Naitore Wangenye on Testify.
Katika hiyo harakati hiyo spirit ikakemewa, mimi nimeona Yesu Kristo namna hii kwa msalaba. Opa, hallelujah, hallelujah.
Every Thursday at 8 p.m. for a moment to grow your faith some more.
Just at the moment, many of those who believe in Jesus are feeling what I call the big squeeze. It feels like the militant forces in society that oppose the gospel have mobilized like never before. Hi, I'm Bernie Diamond, and welcome again to Fresh. Have you been feeling that too? And honestly, as we see governments enacting legislation to limit religious freedoms, as we see those militant forces of evil becoming more and more vocal, more aggressive in jamming, in shutting down the Christian voice, it can feel as though they're winning. There's this thing that rises up inside us that goes something like this. It shouldn't be this way. If God is the King of Kings, why isn't He doing something about this? Why do I feel so persecuted for my faith? Depending on where you live, perhaps there's nothing new in any of this. Or if, like me, you live in a place that's historically encouraged and accepted the Christian voice, maybe this rising tide of persecution comes as a shock, hence that feeling of the big squeeze. But it shouldn't come as any surprise at all. As Paul wrote to Timothy 2,000 years ago, everyone who wants to live showing true devotion to God in Christ Jesus will be persecuted. People who are evil and cheat others will become worse and worse. They will fool others, but they also are fooling themselves. Did you pick that? Everyone, no exceptions. If you're devoted to Christ, you will be persecuted. And that bit about things becoming worse and worse sure feels that way, doesn't it? But here's the good news. Those evil people, they're kidding themselves. Remember, your King is still on His throne. That's His word, fresh for you today. It's under pressure that coal is turned into diamonds, amen? So if you're feeling that big squeeze, I'd love to send you a free copy of our latest life application booklet. It's called The Grace Transformation. To request yours, stop by at christianityworks.com and you'll see that free offer right there towards the top of the homepage. Again, that's christianityworks.com.
Welcome back to Health Check right here, Top TV. Look and Live. My name is Grace Mutiso. We're talking about arthritis today, and I'm hosting Dr. Felix Kuguru, an orthopedic surgeon, with us. Do you have any question or comment? We'll be getting to them in a short while. Keep them coming on the SMS line 20933, WhatsApp line 0708 222 and at Top TV Kenya on Facebook and YouTube. Let me invite back Dr. Felix. So what's the treatment for arthritis?
So treatment, we look at it in terms of non-operative, and then our final line is operative management. So non-operative management includes a physiotherapy program and the use of drugs. And as we said, weight loss is a big contender to that. So the drugs that we use usually, of the studies that have been done, the drugs that have shown being most effective has been anti-inflammatory drugs, your celecoxibs, etoricoxibs, your diclofenacs, aceclofenacs, those kind of drugs have been shown to have the most effect. And also there has been some effect, especially with long-term use of an opioid, which is tramadol. So if you come to me, I will give you celecoxib, I will give you tramadol for your arthritis. That is an anti-inflammatory and an opioid, which is the tramadol. The anti-inflammatory has the effect of reducing pain, and you remember in our opening statement is that arthritis is an inflammatory process.
Yeah.
So celecoxib and diclofenac, meloxicam, all these drugs belong to a family of drugs called non-steroidal anti-inflammatory drugs. So this goes to contend with the inflammation that is going on during the process of arthritis. This is usually, so with an NSAID, tramadol, and then physiotherapy. So for example, if you have knee arthritis, then you will do some exercises to move the joint, so range of motion exercises, and also some strengthening program of the joint, of the muscles that surround the joint. The stronger the muscles that surround the joint, the better supported that joint becomes. That also holds true with the hip and also with the back. So if you strengthen the muscles that hold up the spine, then usually you have some reduction in those in the amount of strain towards that joint, and a better supported joint gives you a bit more pain control. There are also some modalities that physiotherapists use, either warm compress, cold compress. There's some people who have used traction. For example, you put on a bed and just pulled, especially for the back. What I've found to be most effective is the strengthening programs. But the warm compresses, cold compresses, those ones usually, and the massage usually helps with short-term pain. For example, a patient is in a lot of pain, then those are modalities that tend to reduce the acute pain.
Yes.
Then after that process is done, usually I want you to be on a strengthening program. So usually I give you maybe 2 months. Then when you come to me, I usually ask, one of my famous questions is, are you the same? Are you better or are you worse? If you're the same and if you're worse, then now I start thinking maybe we need to move, take your treatment to the next step.
Yeah.
If you're better, I leave you alone, well and good, bye-bye. I'll see you when you have problems. So the next step usually is that sometimes, for example, for the knee and also for the spine, there is an injection that we can give. So there is a steroid injection that we can give. And this usually, so there is a steroid which has an anti-inflammatory effect, and also lidocaine, a drug that is a local anesthetic. If you inject it around that area becomes numb. So a combination of those two is injected into your joint, into your knee. In the spine, they also do a steroid injection just to bring down the inflammation. And then we're just buying time. So when all these modalities fail to work, then all this you've tried maybe 3 to 6 months of of conservative management and these are not helping, then now we start considering surgery. So for the knee, the treatment of choice is a knee replacement. So basically we go at the end of the thigh bone, we cut the end of it. At the end of the leg bone, we cut the end of it. We put in a metal implant, and then a plastic in between. So that is called a total knee replacement. Less and less common if you have one part of the joint that is more arthritic than the other, especially in a young patient, and you have made sure as a surgeon that the rest of the joint does not have arthritis. It is just a compartmental, it is just one compartment with arthritis. They are replacing just that one compartment, which is a unicompartmental knee replacement. But then a total knee replacement means that you're sorting out the whole joint. For the hip as well, we go in, we take off some part of the thigh bone, the top part of the thigh bone, and also replace, do a hip replacement for the same. So for the spine, right now there are studies that are going on in terms of replacing discs and causing to be a motion device within the spine. But that is yet to receive FDA approvals and all that and be available to us. So usually the modality of choice is fusion. So we go ahead and, because we said arthritis is an inflammation of a joint, so if we take out the joint, the problem is no longer there. So we fuse. So for the spine, we do a lot of spine fusions to be able to eliminate that joint. And with the elimination of that joint, then the arthritis then goes away. That is for the wear and tear arthritis. For septic arthritis, that is the infective arthritis, then we have to take that patient urgently to theater and clean out that pus. Pus is very toxic to the cartilage within the joint. Pus causes pressure within the joint, such that actually when you do an ultrasound of a joint before arthritis and with septic arthritis, you see that it's actually been pulled away from each other just because of how much pressure that is within that joint. That increased pressure within the joint limits the blood supply. For example, if you hold your arm in with a little pressure, or if you add the amount of pressure, then the amount of blood supply getting into the joint becomes less and less. So that is a very dangerous thing, and it can, so usually we want to emergently take that patient to theater and wash out that joint and put the patient then on antibiotics after that. For rheumatoid arthritis, a lot of it is managed by a rheumatologist before they come to us. Yeah. Usually we have them put them on some what we call disease-modifying anti-rheumatic agents, and these drugs usually tend to slow down the process and the development of the arthritis. Then once the joint is worn out, then usually they tend to come to us either for a knee replacement, hip replacement, an ankle fusion, an ankle replacement, a shoulder replacement as well.
Wow, that's I'm just listening on the treatment and I'm feeling it's so scary, especially if I have to go to theater.
No. I imagine every day of my life I go to theater.
Yes.
It's not a bad place to be. I think it's not a bad place to be. I think you just demystify the thing. And I think patients react very well when your surgeon is able to take time with you and explain to you exactly what we are doing. This is where I will make my cut. This is what I will do. This is what I expect you to be able to do on day 1. This is what I expect you to be able to do on week 3. This is how long I expect you to be in hospital. I even introduce you to the person who will give you anesthesia, such that you know each other, that you're not in the room with strangers. So you meet with the anesthetist or the anesthesiologist who is going to give you dawa. You discuss what type of anesthesia you're going to get. Are you going to get a regional block? For example, if your subarachnoid block, your numb from your waist down. If you're doing a nerve block such that the nerve that supplies that area is blocked off such that you can't feel it, those things need to be discussed with you as the patient. And I usually find that information is power. The more information that the patient has, the more demystifying, the less scary this procedure looks. I even go ahead and tell you this is what I expect as complications.
Yeah.
In the immediate term, these are my complications. In the intermediate term, these are possible complications. In the long term, these are complications that you would expect. And go through that and have the surgeon, because if the surgeon tells you that this is what I expect, it means that the surgeon is able to anticipate possible complications and actually put in modalities to try to block these things from happening. For example, clots is a big thing after spine surgery and joint surgery, joint replacement surgery.
Yeah.
So we put our patients on anticoagulants. It does not mean that when you're on anticoagulants you will not get a clot, but it just puts you on at a lesser risk of getting the clot.
Okay.
Walking you on day one. For example, my patients on day one after spine surgery or after knee surgery, hip surgery, on day one, I expect you to be on your feet. And even on day 2, day 3, I expect you to be going home. So just be free with your patients, have your surgeon talk to you, demystify a lot of these things. And patients usually respond. I found that more times than not, they tend to respond positively to information.
Okay. Ask. I think that
For sure,
helps
for
and
sure,
demystifies
for
a
sure.
lot.
Yeah,
Okay.
yeah.
We have a few minutes to wrap it up, Dr. Harry. I'm trying to see if we have anything left out, but no. What would be your parting shot to maybe a patient has just been diagnosed, you have arthritis. So your word to them, and for those who already know they have it, and how they can live better.
I think a big part of programs like this is that patients be informed that there is in fact a name to what is ailing them. That this thing that has been disturbing me actually has a branding. You can put a name to it, that it is arthritis. Now that it is arthritis, the next step is to be able to tell them that there is a myriad of things that we can be able to do to get you comfortable. I've taken us through a process of a non-operative period and even towards surgery. So a lot of things can be sorted out with the medicine that we have available today. And largely, joint replacement surgeries have been found to be one of those surgeries that cause patients quite a significant change to the quality of life. Patients who are no longer, there's a lady I did surgery on, aliniambia, when we were leaving the room, she told me ati sasa naenda nyumbani kuchapa mashosho wengine. Because you feel the pain that you had is no longer there, especially for hip and knee replacements. The pain that you had is no longer there. You're able to walk, you're able to do a lot of the things that it's a new lease to life. Yeah, and these options are available locally in the country, and even with insurances, the National Health Insurance Fund, they're able to sponsor and actually pay for some of these surgeries.
Okay. It's doable.
It is doable. It is doable.
Thank you, Dr. And where can we find you?
Day job, I'm in Kijabe, Kio, which is a pediatric orthopedic hospital there. But I'm also in Nairobi running around as well.
Okay. Thank you, Dr. Felix, for gracing us today.
Lots
a lot about arthritis, and I hope our viewers, you've picked a thing or two. And please, if you're feeling those things, especially those of us growing old and you feel your knees are doing they need to come and see you quickly. Correct. So that you're able to curb it early. My name is Grace Mutisa. Wish you a blessed evening. Thank you for joining us on Health Check this day. May the Lord bless you. And please make sure you see a doctor. Go for that checkup. Be checked. Look out for your children. If they behave in a funny way, which is not normal, please rush them for a checkup. Have a beautiful time, and God willing, let's do this again right here at Hope TV on Health Check next week on Tuesday from 7:30 p.m. I'll be looking forward to bringing you a different doctor, a different topic as we learn together on Health Check. Thank you for watching. Good night, God bless, and have a beautiful time. Bye for now.
Asante.